Is duodenal ulcer perforation life-threatening? Imagine suddenly experiencing severe, sharp abdominal pain that comes on quickly and doesn't go away. That could be a sign of a serious problem called duodenal ulcer perforation. A duodenal ulcer is a sore that forms in the lining of the first part of the small intestine. When this sore develops a hole, it is called perforation. This hole allows the contents of the intestine to leak into the abdominal cavity, which can cause dangerous complications. Duodenal ulcer perforation is considered a medical emergency. It can be life-threatening if not treated promptly. The reason is that the leakage of intestinal contents into the abdomen leads to inflammation of the lining called peritonitis. This condition can cause widespread infection and sepsis, which is a severe, systemic response to infection that can lead to organ failure. The risk of death from a perforation varies depending on how quickly the person receives medical care. If treatment begins within a few hours, the chances of survival are much higher. Studies show that early surgical repair can reduce mortality rates to below 10%. However, if treatment is delayed beyond 24 hours, the risk of death increases significantly, sometimes reaching 50% or more. Several factors influence the outcome. Older adults over 60 are at higher risk of complications. Having other health problems, being in shock when arriving at the hospital, or having kidney issues can worsen the prognosis. Lifestyle factors like smoking or low body weight may also play a role. The main treatment for a perforated duodenal ulcer is urgent surgery to close the hole. This is usually combined with antibiotics and supportive care to control infection and stabilize the patient. In some cases, if the perforation is small and the patient is stable, doctors may consider conservative management, but this is less common and requires close monitoring. In summary, a perforation of a duodenal ulcer is a serious condition that can be life-threatening. Prompt diagnosis and immediate surgical intervention are crucial to prevent severe complications and improve survival chances. If someone experiences sudden, intense abdominal pain, especially if it is accompanied by signs of shock or fever, they should seek emergency medical care right away. Always remember, early treatment saves lives, and healthcare professionals are best equipped to manage this critical situation. For anyone suspecting a perforation or dealing with peptic ulcers, consulting a healthcare provider is essential. They can provide personalized advice and appropriate treatment based on individual health needs.